Depression is a very potent risk factor for suicide among people receiving treatment for depression at the VA, with a suicide rate that is 3 times higher than that of the overall VA patient population.
Our research team here at the VA Ann Arbor Healthcare System and the University of Michigan is conducting a series of studies trying to focus and understand completed suicide among depressed veterans. Once you have a diagnosis of depression, the kind of characteristics that are associated with suicide are different than those in the general population. So, for instance, in the general population, older men are at higher risk, but in the VA population treated for depression, younger men are at higher risk. When you think about your more intensive interventions, you really want to target the highest risk people. And our study really shows that efforts that are intensive and tailored should really be directed first at people emerging from inpatient units. Right now, we have very few guidelines for how closely those people should be followed, and I think more attention needs to be directed at the transition programs we might have then, or at other efforts to be in contact with people during this vulnerable period. Already, at least within the VA, there has been increasing attention, along with other suicide prevention efforts, at what we do with inpatients, our highest risk people. There have been more efforts to get them into outpatient services more quickly, and I think we're going to be thinking about other interventions that might reduce the risks.
I served 13 months and 21 days in Vietnam. They took us in boot camp, emptied everything that was civilian out of us, and filled us with everything that was military. When I was discharged from military, that stuff stayed with me. There was no training, there was no preparing me to come back. It affected me in terms of how I dealt with everyday life. When someone said something to me, I was very staunch. I wouldn't give. I had no give to me. And then there were times that I would spend days by myself, not wanting to be bothered with anybody. That's how I lived for 30 years, almost 40 years. I found myself living in a shelter. I found myself with no money, no place to stay. Someone said, Lamont, you need to get help. And so I went back out to the VA. I started talking to them, started getting counseling for post-traumatic stress, started getting counseling for depression. All of it was just beautiful. And I was like, wow, these people really care about me. If I had a message to give to veterans who are coming out of the military now, or even veterans who have been out for a long period of time, nothing's going to happen in your life unless you stand up and you go and take the step to get help. Go get help.